This is a retrospective cohort review of approximately 21,000 female patients in the UK. These women had metabolic dysfunction-associated steatotic liver disease. What they looked at was outcomes for females who were placed on estrogen plus or minus progesterone menopausal therapy matched with a control who was not on any hormone replacement therapy. What they found was that there was significant reduction in any major adverse liver outcomes, such as cirrhosis, spontaneous bacterial peritonitis, and encephalopathy. What they also found was a decreased risk of cardiometabolic issues, such as type 2 diabetes. Interestingly, there was no increased risk of breast cancer or venous thromboembolic disease, meaning blood clots, in any of these women who were on hormone replacement therapy. Also, very interesting, there was a decreased risk of endometrial cancer. As a GYN oncologist, I know the importance of bioidentical hormone replacement therapy. Micronized progesterone is apoptotic to breast cancer cells, meaning it kills breast cancer cells. It's also protective against precancer and cancer of the endometrium. We also know that estradiol has so many benefits. It's going to decrease visceral fat, decrease the risk of insulin resistance, fatty liver disease, and hopefully all of the other cardiometabolic complications. I also love that there are papers like this showing no increased risk of breast cancer, which we know from long-term data in the Women's Health Initiative, and that there was a decreased risk of endometrial cancer. So this supports bioidentical hormone replacement therapy. This is, again, a retrospective cohort review. This is not a randomized controlled trial, but we are seeing more and more data that supports benefit of bioidentical hormone replacement therapy, not just in the cardiometabolic space, but also in the oncology space. Why is this important? This is important because menopause isn't just about hot flashes and night sweats. A lot of women develop fatty liver disease as well as metabolic dysfunction. They can then go on to have cardiometabolic complications. By initiating menopausal hormone therapy, usually with estradiol and progesterone, this can potentially decrease fatty liver disease, insulin resistance, and hopefully all the other cardiometabolic issues that occur due to this process.